Further delay, I would like to call upon Dr. Muldar Sharma sir, SDM COP, to take over the session. Welcome to you, sir.
Now, we'll start with the next chapter. That's karnavyadha vijim adhyayam vyakhyasyaamaha. The procedures related to the repair of the earlobe and nasal structures due to injury. रक्षाभूषणनिमित्तं बालस्य कर्णो विद्येते तौ षष्ठे मासी सप्तमे वा शुक्लपक्षे प्रशस्तेषु तिथिकरणमुहूर्तनक्षत्रेषु कृतमङ्गलस्वस्तिवाचनं धात्यङ्के कुमारधराङ्के वा कुमारमुपवेश्य बालक्रीडनकैः प्रलोभ्य अभिसान्त्वयन् वृषग्वामहस्तेन आकृष्य कर्णं दैवकृते छिद्रे आद्यकर अवभासिते शनैः शनैः दक्षिणहस्तेन ऋजुं विध्येत् प्रथमुखं सूच्य बहलम् आरय पूर्वं दक्षिणं कुमारस्य वामं कुमार्याः ततः पितुवर्तिं प्रवेशयेत् karnavyadha, that's a penetration or puncturing of the earlobe, is having a religious importance as well as a importance from the point of view of the jewelry, that addition of the jewelry. And it also is supposed to have claim to have some health benefits too. And that kind of a practice was existing in India for a long time. Of course, that body piercing or practice of puncturing the ear and is a global practice almost everywhere in the world. That kind of a practice does exist, but most of the other areas, the perception of this puncturing was from a different point of view, from the point of view of either enhancing the sexual activity or enhancing that cosmetic appearance. That was the idea. But in India, the practice is from religious as well as cosmetic point of view, and it also has having claim to have a benefit from the health point of view. Now that procedure is in the domain of surgeons in India. Again, in Sushruta's time, it was in the domain of surgeons, whereas elsewhere, if you go into the history in the global area, this practice was totally out of the purview of medical practice. So anyway, that's one thing. And that procedure would be, you have to have a auspicious day, and usually it's preferred to be done on 6th or 7th month of life of a child, and the child has to be kept comfortably over the lap of a mother or the caretaker, and the attention of the child has to be diverted with the toys, and the correct location of puncturing has to be identified, and that is identified by identifying the thinnest area of the earlobe by exposing it to the sunlight, exposing the earlobe to the sunlight. You can make out the area where it's more transparent, where the rays pass through, and that's the location where it has to be punctured. For puncturing, either it could be needle, pratamukam suchya, bahlam araya, ara shastra, or the suchi shastra. They could be used for puncturing. And once it is punctured, and of course, there was a custom like for a male child, the right earlobe has to be punctured first, and for female, a left earlobe has to be punctured. Particularly, there is no specific medical reason for that. And once it is punctured, there has to be a wick inserted in so that there will be good healing. शोणितबहुत्वेन वेदनया च अन्यदेषु विद्धुम् इति जानीयात् निरुपद्रवतया तद्देषु विद्धुम् इति. Success of puncturing is depending upon the correct location of the area, and this is also called as Daivakrita Chidra. That opening is considered as a Daivakrita Chidra in the sense there is a natural tendency for the opening, and that opening has to be done. And if you have punctured properly, there will be no bleeding and not much of a pain. If the puncturing site is not proper, there can be bleeding as well as pain. Now, in Sushruta and in our Indian Vedic practice, the practice of puncturing is only at the earlobe. Whereas, if you look at the practice globally, and the different locations of puncturing of the earlobe, this is from certain resources, where almost every part of the pinna of the ear is being punctured. And of course, in India also now, in certain communities, this kind of a practice does exist where you have multiple puncturing. But the traditional Vedic method of puncturing is only a single puncture in the earlobe. Now, these are all the existing practices in the present day situation. तत्र अज्ञेन यदृच्छया विद्यासु शिरासु कालिका मर्मरिका लोहितिका उपद्रवाः भवन्ति. Now there are three specific vessels or the siras identified by Sushruta in the earlobe, and they are named as Kalika, Marmarika, Lohitika. From the current anatomical point of view, to identify such three vessels, named vessels, is practically not possible. But the complications which can be produced due to puncturing of these vessels are तत्र कालिकायां ज्वरो दाहः श्वयतु वेदना भवति, मर्मरिकायां वेदना ज्वरो ग्रन्थेश्च, लोहितिकायां मन्यास्तम्भः अपदानक शिरोग्रह कर्णशूलानि भवन्ति. The complications which can be produced due to puncturing of these vessels, they are suggestive of infective complications. Jvara daha shvayatu, swelling and pain if it is kalika which is punctured. Marmarika if it is punctured again, it's jara granthi, there could be local hypergranulation wound, and of course pain. In Lohitika there would be systemic complications like tetany, manyastambha, apatanaka, so tetanic complications could occur. Now whether these infective complications are related to the exact location or that infective complications are produced due to unhygienic conditions of the puncturing, the issue of controversy. Anyway, we will not go into much of that. But from the current perception point of view, the infective complications are related to the external factors of maintaining the hygiene, whereas Sushruta had suggested that these complications are specific to the site of injury. Teshu yathasam pratikurvita. They need to be treated as such. क्लिष्ट जिह्म अप्रशस्त सूची व्यधात् गाढतर वर्तित्वात् दोष समुदायात् अप्रशस्त व्यधाद्वा यत्र संभ्रमो वेदना वा भवति तत्र वर्तिम् उपहृत्य आशु मधुक एरण्डमूल मञ्जिष्ठायव तिलकल्कैः मधुघृत प्रगाढैः आलापयेत् तावत् यावत् सुरूढमिति सुरूढं चैनं पुनर्विध्येत् विधानं तु पूर्वोक्तमेव. Now, the Sushruta also has identified the complications produced due to the improper handling of the procedure. Either it could be due to the your improper needles, instruments, the suchi needle itself either blunt or bent or so on, or it could be due to the unhygienic conditions that there could be pain and the discomfort to the child. In such conditions, where the abnormality of, or the variation in the technique has resulted in complications, that needs to be treated with removing that varti and then local application of the alepa, and it has to be treated as you treat any of the wound. तत्र सम्यक् विद्धम् आमतैलेन परिषेचयेत्. तैः च वर्तिं स्थूलतरां दद्यात् परिषेकं च तमेव. Once it is punctured properly, it has to be treated with a fresh oil, freshly extracted oil. Amataila is a freshly extracted oil, or it also may be translated as virgin oil. Now, that's again a issue of bit confusion. Well, Amataila, either it could be a freshly extracted oil or it could be virgin oil where heat is not used for extraction of the oil as such. तत्र व्यापकत दोषोपद्रवे कर्ण्य वर्धनार्थं लघु वर्धनकं कुर्यात्. Vardhanaka is the next level where the size of the opening is enhanced. The idea of opening, size of the opening being enhanced is again a perception of the beauty in that period. The one with the bigger opening in the earlobe was considered to be more beautiful than the others. In the present situation, from the medical point of view, that body piercing is a very significant issue. Though it's not from the medical point of view, like the surgeons are not really responsible for this, but it's a social custom, or often it's also a fashion now. And based upon the data which we get globally, now it's not from only our area, India, globally the size of the body where the puncturing is popular is navel, nose, tongue, nipple, eyebrow, lip, and genitals. Genitals also are being punctured in many of the areas as such, and both in male and female, this kind of practice does exist, and most of the times the aim or idea is sexual stimulation or maybe something of a better performance sexual. That's in majority of the area, the perception. Of course, or it could be just considered as a weird passion. And from the medical point of view, the incidence of complications is quite important, and that incidence of complications produced due to the passing practice as well as the unhygiene conditions which could be related to are quite significant, and the study is as per the data, around 31% had complications, and about 0.1% had required hospitalization. Complications related to that also were noted. And then, of course, professional help was needed due to the other complications in about 15%. This is based upon certain data, not from the scientific papers, but it's from the general commercial trade as such. Now that Vardhanaka is one of the technique where the opening is increased, and when during this process, if at all there is a possibility of an injury, then that results in a torn earlobe. एवं विवर्तित कर्णः छिद्यते तु विधानृणां दोषतो वा अभिघातद्वा सन्धानं तस्य मे शृणु. So the total aim of the theme of the present chapter is to repair that earlobe puncture. That procedure of puncturing of the earlobe is just a minor issue. The major issue is about repair of the earlobe which has got punctured. So the details are of this. Now, Sushila has given a extensive detail of these complications which could be produced due to the injury, as well as certain maybe congenital abnormalities of the earlobe. Now, when I say congenital abnormalities of the earlobe, statistical incidence of congenital abnormalities of the earlobe are quite high compared to the congenital abnormalities of all other organs. The earlobe abnormalities are quite high, and in the present day situation too, the technique of repairing the earlobe, lobuloplasty, repairing the earlobe, is a major area of the plastic surgery. And most of the concepts of the plastic surgery are described by Sushruta in this chapter. Now, based upon that, different techniques required, as well as the abnormality, visible abnormality of the earlobe, Sushruta has classified those possible abnormalities of the earlobe into 15 varieties, and they are Nemisandhanaka, Utpaladhedyaka, Valluraka, Asangima, Gandakarna, Ahariha, Nirvedhimah, Vyayodimah, कपाटसन्धिकः अर्धकपाटसन्धिकः संक्षिप्तः क्षीणकर्णः वर्गीकर्णः यष्टीकर्णः काकोष्ठक इति. The 15 varieties of the abnormalities are mentioned. Now, what are these? The Tuthula Ayata Sama Ubhayapalihi Nemisandhanaka. Nemisandhanaka is when the torn earlobe has two segments which are almost equal and the tear is somewhere in the middle, and hence your repair technique would be considering this as such. Vrutta Ayata Sama Ubhayapalihi Utpalavedyakaha. If at all the area is curved and one piece of the earlobe is more curved and the other is somewhat straight, and the incision is curved, that's the Uttara Bhedyaka. And Hrasya Vrutta Samaya Upalihi Valluraha. If one of the earlobe is constricted due to the scarification and it becomes irregular, that's the Valluraka as such. Abhyantara Dirghikapalihi Asangimha. If at all the inner component, the medial component of the earlobe is longer and the outer lobe is shorter, which could be a congenital variation. I don't say that this could be a complication of the injury, or it can, similar complications also can occur due to scarification, which require a treatment. Now, because of this hanging earlobe, it looks like elephant's ear. So, it's one of the areas where people go for the plastic reconstruction surgery, and after reconstruction, it can go to that level. So, that the area of reconstruction technique has to be a variant like. Bhashya Dirghikapalihi Gandakarnaha. If a similar abnormality, again a congenital abnormality, where the lateral component of the pinna of the ear has become bulged like or extensive, then that requires a repair, and that's the Gandakarna as such. Apari ubhayatopi aharya. Apari is a absence of the ear lobe, that the pinna of the ear. Again, there could be lots of abnormalities and variations, and those variations can result in a visible abnormality, and that requires a repair, and that's the aharya. Now, aharya karnabandha is the major area where the important principle of plastic surgery are described, where a flap from the other side is taken, flap from the chin is taken, and surgery is done, and it's repaired. And this is exactly the same procedure which is done even now for a absence of the earlobe or maybe feeble agenesis of the earlobe pinna. The repair technique are the main same as what's mentioned by Sushila. We'll come to that bit in more detail later. पीठोपमपालिः उभयदक्षिणपुत्रिकाश्च आश्रितः निर्वेधिमः. If the base of the ear lobe is deficient and the pinna has become hypertrophied, the shape of that kind of a shape is the nirvedhima, which is again a congenital variation. Sthula anusama vishamapalihi vyayojima. Vyayojima is when there could be multiple irregular areas. Some areas are small, some areas are bigger, and this again can occur due to the infective complications and hypergranulation tissue, and repair of that is the Vyayojima technique as such. आभ्यंतर दीर्घैकपालिः इतर अल्पपालिः कपाटसन्धिकः, having a twin something like having a twin earlobes and the separated something like a segregation separated earlobe, and one earlobe seeming to be smaller and other being bigger. So this kind of abnormality is the kapata sandhika. And bahya dirghakapalihi itar alpapalihi ardhakapata sandhika is similar twin situation where both the two earlobes seem to be presented over there, and one is being bigger, the external one being bigger, and the other is smaller. That's the ardhakapata sandhika. These are all suggestive of Sushruta's idea of look or Sushruta's detail of going into the abnormalities. यस्य पारिद्वयमपि कर्णस्य न भवेत् इह कर्णपीठं समय मध्ये तस्य विद्वा विवर्धयेत. Now the another complete a complete atrophy, total atrophy of the earlobe is also another of the possibilities. So these are all the different abnormalities, and it's quite important to study these abnormalities and plan the treatment. And planning of the treatment is tatra the treatment would be based upon तत्र दशैके कर्णबन्धविकल्पाः साध्याः. The first 10 up to the kapata sandhika, they are sadhya, they can be cured, treated. And tesham Sushila has suggested tesham sonam eva akrita tayana vyakhyataha. But we have this kind shown that shapes from the possible sources from the internet. Then तत्र संक्षिप्तादयः पञ्च असाध्याः. The last 5 are like शुष्क, शष्कुरि, उत्सन्नपालिः, इतर अल्पपालिः, संक्षिप्तः, अनधिष्ठानपालिः, पर्यन्तयोः क्षीणमांसः, हीनकर्णः, तनुविषम अल्पपालिः, वर्लीकर्णः. These congenital abnormalities where there is a total atrophy, they are not curable. ग्रथित मांस स्तब्ध सिरातद सूक्ष्मपालिः, यष्टिकर्णः, निर्मांस संक्षिप्त अग्र अल्पशोणितपालिः, काकोष्ठकेति. These are all the variations of the congenital atrophy or agenesis. Now these are the agenesis are those agenesis conditions are भाष्याम इह दीर्घायाम संधि आभ्यंतरो भवेत, आभ्यंतरायाम दीर्घायाम भाष्य संधि उदाहृतः. Now basic ideas or basic concepts of the treatment of or plastic surgery is depending upon the abnormality, you have to identify which is the abnormal area and plan in such a way that ultimately you will have to have a proper shape, and the suturing could be either on the medial side or the lateral side. So whether it is the medial or the lateral side of the torn earlobe which is to be repaired, you need to have a balanced incision. That planning of the balanced view is the basic idea of the reconstructive surgery. That एकैव तु भवेत् पालिः स्थूला पृथ्वी स्थिराचया तां द्विधा पाठयित्वा तु छिद्वा च उपरि सन्धयेत्. Suppose there is a deficiency of the tissue is not enough there, then there is one option. There are many options of plastic. This is a very basic idea of the plastic surgery. When there is only one component of the tissue and the other tissue is deficient, one of the options for that is a duplication. Slit open that tissue, and by slitting open that tissue, the one flap of that tissue is again used for reconstruction. So a minor flap by this splitting of the tissue is one, or it's also called as a local flap. Local flap technique is one technique of plastic surgery, where, as you have seen in the image, if there is a deficiency of the tissue, there is a incision is made, and then that split area is again pulled down and reconstructed. That kind of a technique is possible. And another most important and very advanced technique for the plastic surgery is the Aharya Bandha, where ಗಂಡಾದ ಉತ್ಪಾಟ್ಯ ಮಾಂಸೇನ ಸಾನುಬಂಧೇನ ಜೀವತ ಕರ್ಣಪಾಲಿಮಪಾಲೆಸ್ತು ಕುರಿಯಾನ್ ನಿರ್ಲಿಖ್ಯ ಶಸ್ತ್ರವಿದ. That's if there is a absence of the tissue, you have to make a incision in the chin area nearby. The shape of the incision would be again planned according to the amount of the tissue required, and that flap is reverted. The same flap is reverted, turned back, keeping that integrity of the blood vessel. So Sanubandhena, that's the most important idea, is to maintain that vessel. That flap is just turned back, keeping that base as such, and again the tissue is reconstructed and then you repair. Now this is the most popular technique of repairing any of the tissue and most popular principle of the plastic surgery even now, where the maintenance of a vascular continuity of the flap is the basic idea. Of course, today the planning and the approaches are many folds, like multiple folds, and based upon the anatomy, you can have huge permutation and combinations of these kind of techniques, and it's not limited only to the earlobe. That idea of a vascular flap technique is used in any other part of the body depending upon the status over there. Now, these are about the principles of the curable varieties. Now, the incurable, the 5 incurable varieties are Shushka, Shashkuri, Utsanapali, Alpapali, Sanshiktaha. These are considered as incurable by Sushura. A congenital atrophy where there is a fibrous and a very thin tissue over there. That's a incurable form of abnormality. And anadhisthana parihi paryante yokshinamamsa hinakarna. Hinakarna is where virtually you don't see a ear opening and only some traces of the tissue is left over. These are the other varieties. Then Tanu Vishama Alpapali Valikarna. Valikarna is where there is a gross deformity of the pinna and that pinna has become curved and irregular. That's the one. Grastita Mansa Stabda Siddhartha Sukshma Palihi Esti Karna. Esti Karna is where there could be hypergranulation tissue or nodular tissue formation, which could be an acquired pathology, and Sushma has considered this as a incurable. Nirmansa Sanshipta Alpashonita Palihika Kostaka. Avascular area of the earlobe with the atrophy, gross atrophy, also is considered as a kakostaka. So these names of different varieties, they are mentioned by Sushruta, and these 5 varieties, they are considered as incurable, and even now most of these conditions cannot be repaired. Instead, now you have a technique of these transplants, the keeping artificial structures or prostheses. Earlobe prostheses also are now quite popular, where you can have a choice of shape of the earlobe with the different materials, flexible materials, which may have the same resemblance that of the skin and the other tissues, surface area. So that's one area where you may have some more technique than what Sushila has mentioned, but otherwise the basic principles are the same. Now, the technique of duration of surgery is in the Sushila has detailed about that basic idea of surgery in the beginning. Now, the detailed technique is अतो अन्यतमं बन्धं चिकीर्षुः अग्रोपहरणीय उक्त उपसंहृत संभारं विशेषतश्च अत्र उपहरेत् सुरामण्डं क्षीरम् उदकं धान्याम्लं कपालचूर्णं चेति. For the plastic surgery, the other protocols or preparation of the surgery are the same as that of the agropharnia dhyaya, where you need to have the instruments and so on. Specific furthermore would be suramanda, the clear portion of fermented liquid, acid wash for cleaning the area up with acid wash. And Kshiram Udakamcha, for cleaning, Sushil had used either a acidic substance of the fermented product, or dhanyamla, again an acid wash, or it could be neutral substances like Kshira and Udaka, butter and the milk. Now, or Kapala Churna Jeti. Kapala Churna is the finely powdered these pots, pot material. That's something like soil, but it's a use for giving a shape. As we use plaster of Paris now, an alternate to the plaster of Paris used by Susura was a Kapalaturna, the powdered brick or powdered pots, so that you will have a sustained support to the tissue. ततो अङ्गनां पुरुषं वा ग्रसितकेशान्तं लघुभुक्तवन्तं आप्तैः सुपरिगृहीतं च कृत्वा बन्धम् उपधार्य छेद्य भेद्य लेख्य व्यधनैः उपपन्नैः उपाद्य कर्णशोणितम् अपेक्ष्य दुष्टम् अदुष्टं वा इति तत्र वातदुष्टे धान्यां उष्णोदकाभ्यां पित्तदुष्टे शीतोदकपयोभ्यां श्लेष्मदुष्टे सुरामण्ड उष्णोदकाभ्यां प्रक्षाल्य कर्णौ पुनः अवलिख्य अनुन्नतम् अहीनम् अभिशमं च कर्णसन्धिं सन्निवेश्य स्थितरक्तं सन्दध्यात्. The protocol of preparation is the patient's part, that operating part has to be prepared, the hairs have to be kept apart, and so hairs do not cover the area. And for karnavyadha surgery, Susuta suggests about a light food being given to the patient prior to the surgery, and rationality of giving food and not giving food we have discussed in the previous chapter. And the patient is positioned, and the optimum procedure which is suitable for that kind of abnormality, which we have already detailed. It could be selected, it could be Chedana, Vedana, Rekana, any of those procedures as per requirement. And one of the other important is the by looking at the color of the blood, the dosha dusti has to be assessed, and you need to process the tissue with the specific substance according to the dosha. Tatra vata dusti dhanyam ushnodakabhyam. If it is a vata dusta rakta, then dhanyamla and ushnodaka is used. Pitta duste shitodaka payobhyam. If it is pitta dusti, it's cold water or milk which is used for cleaning. And suram and ushnodakabhyam prakshalya. Kapadusti, if it is kapadusti, suramanda is used. And this is a unique idea of treating the local complications as such, which cannot be explained, which cannot be explained with the contemporary perception of the disease conditions. Then once the tissue is placed in proper manner, ततो मधुकृतेन अभ्यच्य पीठप्रोतयोः अन्यतरेण अवगुण्ठ्य सूत्रेण अवगाढम् अनतिशिथिलं च बद्ध्वा कपालचूर्णेन अवकीर्य आचार्यकम् उपदिशेत. द्विवर्णयोक्तेन तपः. The area has to be covered with a bandage, and it has to be positioned firmly and immobilized with the Kapala Churna. That instead of plaster of Paris, Sushil had used the Kapala Churna to give that support, rigid support. Then the further management will be as you plan the management of any of the other wounds, that the protocols of Shashthirupakrama, Vranachikitsa, they have to be followed. Bhigattanam divasutnam vyayamam atibhojanam vyavayam agnisantapam vakshramam cha vivardheta. In the post-operative period, a possible friction over the area and sleeping during the daytime, excess of exercise or excess of food, sexual indulgence, or exposing to hot sunlight or maybe heat as such, or speaking too much also are to be avoided. So that's a physical as well as the rest to the body is required as such. न च अशुद्धरक्तम् अतिप्रवृतरक्तं क्षीणरक्तं वा सन्दध्यात्. If at all there is a abnormality of the blood, the visible dosha drusti is seen over the area due to the pre-existing complications, it should not be treated till that dosha drusti has to be treated as. Dosha drusti has to be treated either with the local option of choice of liquid substances like Suramanda or Udaka, Kshira, or maybe the Dhanyamla, the preferences, or it could be like the even systemic treatment of Vata Pitta Hara Chikitsa. Now, the complications which can occur if you have not treated the doshas in the beginning would be स हि वातदृष्टेरक्ते लूडोपि परिपुटनवान्. If there is a vatadrushti, if your healing would not be proper, there is a tendency for the recurrence. The tissue may become cracked, like due to improper formation of the granulation tissue. The tissue may become cracked and it may not gain the sufficient strength. Pitta Dushti Dahapakara Vedanavan, if there is a Pitta Dushti, it can result in infective complications like the pus formation, pain, inflammatory signs, hyperemia, etc. Shleshma Dushti Sabdaha Kanduman, if it is a Kapha Dushti, it can become numb or maybe itching could be seen. Ati Pravartirakte Shavashofwan Chino Alpamanso Navurdhimeti. If there is excess of bleeding and if the swelling, the tissue has become bluish color, that's the tissue doesn't have sufficient blood supply, that results in the bluish coloration, cyanotic changes may be seen. And if at all there is a cyanotic change, that tissue will not survive. Kshinaha alpamsaha, if there is a atrophied tissue and lesser soft tissues, such plaques would not survive. They cannot be used as such. Amatailen Triratram Parishetet, Triratratya Pitum Parivartet. For 3 days, the Amataila has to be used, and so this is for the repaired conditions. For the first primary puncturing, this rule is not true. You apply the Amataila continuously. For after the repair, it has to be for 3 days the Amataila, and after the 3 days, you have to change the bandage. The pitum parivartet. स यदा सुरूढ़ः निरुपद्रवः सवर्णो भवति तदा एनं शनैः शनैः अभिवर्धयेत्. So once the earlobe has become proper, the tissue has become survived, then the puncturing process and then the vardhana process can be repeated. You have to puncture and then the same opening can be enhanced as such as you do in the normal tissue, but only after the tissue has gained sufficient strength. अतो अन्यथा if these precautions are not followed, संभ्रम दाहपाक राग वेदनावान पुनश्चिद्यते वा अथ अस्य अप्रदुष्टस्य अभिवर्धनार्थम अभ्यंगः. Now once you have seen that there is no such complications, it can be repunctured and then you may have to use the vardhanaka as you follow. But if at all your assessment is not proper, then it can result in the complications of the sepsis. And in such a sepsis complications, the treatment has to be again as you treat any other septic complications, and specific substances are तद्यथा गोधा प्रतुद विष्किद अनुप उदक वसामज्ञानः पयः सर्पिस्तेदं गौरसर्पशजं यथालाभं. For the Abhyanga local users, Sushu has suggested about a preparation of the taila where the godha, pratuda, vishkira, the grains, different grains, as well as anupaudaka vasamajana, the products of animal origin, and payaha sarpi, milk or the ghee. These have to be used for local application or local uses. Like then samrutya arka alarka atipala ananta apamarga ashwagandha vidari gandha kshira shukla शुक मधुर वर्ग पयस्य प्रतिवापम तैलम पाचयित्वा सुनगुप्तम निदध्यात्. Or the other taila which could be prepared from these plants like arka alarka etc. Now श्वेतित उन्मत्तितं कर्णं स्नेहेन एतेन योजयेत् अथ अनुपद्रव सम्यक् बलवांश विवर्तते. These tailas can be used for the sustenance of the tissue and prevention of the complications. यव अश्वगन्ध यस्यापैः तिलैश्च उद्वर्तनं हितं. If there is some slimy discharge, udvartana, dry powder could be used of yava ashwagandha yasti tila to ensure the normal appearance of the tissue. Dry powder could be applied of these substances. शतावधि अश्वगन्धाभ्यां पयस्य एरण्डजीवनैः तैलं विपक्वं सक्षीरम् अभ्यङ्गात् पारिवर्धनम्. To stimulate the tissue to grow, you may use Shatavari Ashwagandha Payasya or Eranda Taila. These could be used with the Shira as local application to help in improvement of the or growth of the tissue there. ये तो कर्णाः न वर्धन्ते स्वेद स्नेहोपपादिताः तेषाम् अपाङ्गदेशे तु कुर्यात् प्रच्छानमेव तु बाह्यच्छेदं च न कुर्वीत व्यापकस्यूततो ध्रुवाः. Due to local complications, if the tissues do not survive, one of the options suggested by Susura is a prachana. So practically how far it is true, that's questionable, but it's a sort of improving the vascularity or enhancing the vascularity, particularly if at all there is a vascular edema. And in such a condition, this kind of approach may be practically useful. And local bloodletting rectomotion is suggested as one of the options. बद्धमात्रं त्यक्कर्णः सहसैव अभिवर्धयेत् आमकोशी समात्मातः क्षिप्रमेव विमुच्यते. If at all you apply Amadela in much before the tissue has become survived, so if there is an improper technique, temporarily it may look like that there is a tissue healing, but there would be a hematoma formation. Amakoshi. Amakoshi is where there is a accumulation of that abnormal substance, hematoma formation, and that hematoma may in due course of time result in dehiscence of the tissue. The tissue may dehisce. That's a absolutely practical issue from the surgical point of view. And it's not related to only the plastic surgery. Even in plastic surgery, this is a major issue in plastic surgery. And even now, in the plastic surgery practice, in the current practice, if at all there is such a complication, possibility of the hematoma formation, Jalokas, leeches are used, which we have just referred to in the previous sessions, like related to Jaloka. So, use of Jaloka to prevent that hematoma formation is a very popular practice in plastic surgery now, though in the regular surgeries it's not practiced. And this is to prevent the possibility of hematoma. Sushruta has suggested Prachana there, not the Jaloka. Now, ultimately, a perfect healed tissue would be Jatavomaha, Suvartma, Shrishtasandhi, Samaha, Stiraha, Surodho, Avedana, Yashtatam, Karnam, Vardhet, Shanihi. A perfect healed tissue would have all the appendages of the skin, like the hairs, and the appearance of the skin also would be perfect. And the joint area, the area where you have suture, which also will be stronger and uniform, there will be no abnormality. Then that condition of that status of the earlobe can be considered as a properly cured, and further you may use the Vardhanaka techniques, the enhancing techniques could be used. Now, Amitaha Karnabandastu, Vijnayaha Kushaliha, Yo Yatha Suvishista Syadatam Tatha Vinyojeta. The varieties or abnormalities of this Karnabandha could be many, and hence Sushruta suggests you have to plan based upon your intelligence. Now, from the point of view of plastic surgery or reconstructive surgery, the basic concepts of the reconstructive surgery mentioned by Sushruta are very much advanced, and except for a few techniques like transplants or maybe the prosthesis, other basic techniques are mentioned in Sushruta 5000 years back. But if you look at the Western surgery, the basic idea of a reconstructive surgery was started by Pare in 1564, where he has given certain basic principles like take away what is superfluous, restore to their places things which are displaced, separate the issues which are. I have copied it directly from Paris textbook 15,064 to show like how much advanced Sushruta's techniques were. Now, these are the basic ideas of the surgery as such. Now, whatever is practiced now as most popular plastic surgery and who is considered these in the contemporary surgery, Gillis and Miller are considered to be the pioneers of plastic surgery of present day situation, and their 10 dictums, the final some dictations of final dictums of the plastic surgery are: thou shalt make a plan, so thou shalt have a style, and honor that which is normal and return it to the normal position. Thou shalt now throw away a living thing, and thou shalt not bear a false witness against any defect as such. Thou shalt treat the primary defect before worrying about the secondary one, and thou shalt provide thyself with a lifeboat. Thou shalt not today what thou can put off until tomorrow. So these are all the basic concepts of the plastic surgery, which are considered to be the 10 dictums of the plastic surgery. Compared to these basic principles, whatever Sushruta has mentioned seem to be very much advanced and more mature, and that's the purpose of showing this, not to criticize other. Whereas in the contemporary plastic surgery, there are many technologies added, and these technologies also are, as I told, the free tissue transfer is the basic idea. Now, whenever the certain concepts of the plastic surgery are, whenever there is a possibility of the wound to heal by primary or secondary intention, allow it. If it is not possible, then they close the tissue by direct closure. If not, then skin graft. If not, the local tissue transfer. Local tissue transfer, as in case what we have discussed, like where the local tissue, you may split the tissue and then duplicate the tissue and then use for repair so that the appearance is there. Or it could be the flap where the tissue, the as Aharivan, the Sushra has mentioned, that's the issue which can be taken. And the next is the flap surgery, the where the flap could be extended, regional tissue transfer, or the last is a tissue transfer, the transplants. These are the techniques from Sushila's point of view. These up to this level, Sushila has describes only the last portion is not mentioned by Sushila. These are the editions of the last 5,000 years. When I say, and one more of the concept technique which is now popular in addition to this is the tissue expander. Tissue expander is putting a stress upon the tissue so that the tissue expands. But this is done now to maintain the shape of the organ, particularly in after mastectomy. Whereas Sushila had given the idea of Vardhanaka. The Vardhanaka, the idea of tissue expansion, but that perception of the tissue expansion in the Vardhanaka is to enhance the opening of the earlobe, whereas the idea of tissue expansion now is to enhance the density and the this reach of the tissue by keeping certain substances inside. But the basic perception is the same. See, in the Vardhanaka, you will keep some solid substance in the opening so that the opening increases. But now you keep a solid substance below the tissue so that the tissue becomes stretched. So it's a modification. But anyway, that idea also is mentioned by Sushila to a certain extent. Now, the further, this is about the basic surgical techniques. Now, coming to the other advanced issues, कर्णपाल्यामयां नृणां पुनर्वक्ष्यामि सुषुधा कर्णपाल्यां प्रकुपिताः वातपित्तकफास्त्रयः द्विधा वा अपि अथ संसृष्टाः कुर्वन्ति विविधाः रुजः विस्फोटः स्तब्धता शोभः पाल्यां दोषे तु वाटिके दाहः विस्फोटजननं शोभः पाकष्टपेटिके खण्डुः श्वेतुः स्तम्भः गुरुत्वं च कफात्मके यथा दोषं च संशोध्य क्रियात् तेषां चिकित्सितम्. Now, once you have treated that earlobe, there is a possibility that there could be a local complication of the in due course of time due to the dosha vishesha. Either it could be systemic or the other local complications which can occur, and those complications have to be assessed as you assess any of the other lesions by the dosha lakshanas. Like if it is a vata complications, then it could be result in a vispota, stabdata, shopaha. There could be abnormality of the sensation, cracking of the tissue. And if it is pitta, then the signs of paka, separation. In kapha, there could be local itching and swelling, stasis, acid. So, if at all these later delayed complications can occur, those delayed complications have to be treated as you treat any other doshas elsewhere. Yatha dosham samshodhya kuriyat tesham chikitsitam sweda abhyanga parishekehi pralepa asva vimokshnehi mritvim kriyam brahmanihi yatha sumja bhojanehi tata ya evam veti doshanam chikitsam kartum arhati. The same principles of treatment of dosha elsewhere, they are applicable here, where you may prefer any of the techniques like local swedana, etc., or internal administration of the medicines, or the shodhana chikitsa. Now, the other upadravas, complications which are possible later, delayed complications can occur, result in the abnormalities, are according to Sushita, he has given the names, and those are अथ ऊर्ध्वं नामलिङ्गैः वक्षे पाल्याम् उपद्रवान् उत्पाटकश्च उत्पुटकः श्यावः कण्डूयितो भृशम् अवमन्तः सकण्डुकः ग्रन्थिको जम्बुलस्तथा स्रावी च दाहवांश्चैव शृणु येषां क्रमशः क्रियाम्. The complications could be there could be fibrosis, and the shape could be abnormal, and those abnormal shape could be utpadaka, utputaka, etc. Or there could be abnormality of the vascularity which can result in bluish color, or local irritation of the skin which can result in itching or discharges, or maybe hypergranulation tissue, and these are all the possible complications which can occur in due course of time due to a graft non-perception. This is what you see regularly even now in patients who have the grafts. After a certain period of time, a progressive, gradual rejection of the graft is a major problem, and often it occurs due to immunological reactions. And Sushruta has suggested the treatment like in such conditions, apamargah sarjarasah patala lakuchatvajau utpatake pralekha syat tailam yebhishcha patayet. Local application of the taila or shambaka shikru putikan bodha meda tadvasam varaham gavya enayam pittam sarpishta samsajet or ghruta for pitta dosha or lepam mukkutake dadya tailam yebhishcha satyam गौरीं सुगन्धां सस्यामां अनन्तां धन्वीयकां शावे प्रलेपनं दद्या तैलं येभिश्च साधितं पाठां रसायनं क्षौरं तदा स्यात् उष्णकाञ्जिकं दद्यात् लेपनं सकन्दूके तैलं येभिश्च साधितं. The taila or kanjika, they could be used in kapaja vyadhi. The different preparations are mentioned. Now, if at all it results in a wound later, Vranidhutasthideyam syadidam telam janata. If it becomes a big wound and there is a total rejection of the tissue, rejection of the tissue after plastic surgery is a frequent complication. There, Sushruta has suggested about a taila, and that taila is a madhuka kshira kakoli jivakadyehi vipaditam bodha varaha sarpanam vasahasyu krutabrahmane pralepanamidam dadyat avasitya avamantake propoundadikam madhukam samangam dapamema cha तैलं मेभिश्च सम्पक्वं क्षुरं कण्डूमदस्क्रियां सह देवा विश्वदेवाः अजाक्षीरं ससैन्धवम् एतैः आलेपनं दद्यात् तैलं मेभिश्च साधितं ग्रन्थिते गुटिकां पूर्वं श्रावयेत् अवपाट्यतु ततः सैन्धवचूर्णं तु घृष्ट्वा लेपं प्रलेपयेत् लिखित्वा तत्श्रुतं घृष्ट्वा चूर्णैः लोधस्य जम्बुले क्षीरेण प्रतिसार्ययेनं शुद्धं संरोपयेत् ततः. Now, these are the different options of the treatment like Taila, Dhruta, or maybe the Avachurnana or Lekhana, depending upon the abnormalities. And as Sushil has mentioned, like the names of these abnormalities like Granthika or Thumb Ambula, and that the specific treatment. Of course, this is a general protocol which could be used in any case of the Vrana, complications of the Vrana. That's about the karnavyadha bandha. विश्लेषितायाः स्तोतनासिकायाः वक्ष्यामि सन्धानविधिं यथावत् नासाप्रमाणं पृथिवीरुहाणं पत्रं गृहीत्वा तु अवलम्बितस्य तेन प्रमाणेन हि गण्डपार्श्वात् उत्कृत्य बद्धं तु अधनासिकाग्रं विलिख्य च आशु प्रतिसन्धीत तत्साधुगन्धैः पिशकप्रमत्तः सुसंहितं सम्यगतो यथावत् नाडीद्वयेन अभिसमीक्ष्य बुद्ध्वा प्रोन्नम्य च एनम् अवचूर्णयेत् पतंग यष्टि मधुकाञ्जनैश्च सञ्छाद्य सम्यक् प्रचुनासितेन तैलेन सिञ्चेत् असकृत्तिलानां घृतं च प्राप्य स नरः सुजीर्णैः स्निग्धो विरेच्य स यथोपदेशं रूढं च सन्धानमुपागतं स्यात् तदर्थशेषं च पुनर्निकृन्तेत क्षीणां पुनर्वर्धयितं यतेत समां च कुर्यात् अतिवर्धमानताम्. Another of the complications which used to be seen by Sushruta was the abnormalities or injury to the nose. Now, whether there was a practice of puncturing the nose during that period or not is questionable. That's again a controversy. But injury to the nose was more common during that period because cutting the nose was considered to be one of the punishment and very frequently done punishment for different offenses. And reconstruction of the nose was one of the areas where Sushruta mentions about the basic concepts of plastic surgery, where the tissue could be extracted from the chin area and to the rigid support to the tissue, giving a shape or molding of the tissue is another basic concept of the plastic surgery. To mold the tissue, Sushruta had suggested to use a tube into the in the nostrils, and over the tube the tissue has to be placed from the chin area, and that's exactly the technique which is done now. If at all there is an injury to the tissue, the same technique is followed. But and for keeping this support, instead of simply any tube, now you may have more shaped or fibers, fiber or other synthetic substances that could be used for maintaining the shape. Of course, now another of the option now is a pure complete prosthesis. Nasal prosthesis also are being used. Now anyway, the basic idea of the tissue repair is the same even in case of the nasal surgery. In addition to that, there is the basic idea of a molding or giving a shape to the tissue where you will have a hollow tube to breathe in. And one of the most important thing which I would like to highlight is the Sushruta surgical text is translated in and then presented as a specific credit in the Australian Journal of Plastic Surgery, where credit of it is given to Sushruta as the real origin of plastic surgery. And unlike other journals, this has a true translation of Sushruta text as such. So from that point of view, because it's a something unusual where the Western people accept this Sushruta as the father of or maybe the pioneer of surgery. This is one area where it is identified, and instead of simply a casual reference, the same is translated. Nasal technique is translated. From that point of view, is significant. Otherwise, not much of a significant issue. नाड़ी योगम विनष्टस्य नासा संधानवत् विधिं स एवं एव जानीयात् सराज्ञः कर्तुमर्हति. These for Osta Sandhana. The lip also is another area where the Sandhana can be done, that reconstructive surgery may be needed, and the basic principles of the same reconstructive surgery has to be used. And last, of course, in the present day situation, the Western practice, that body piercing of the genital area has become a certain fashion, and this is from one of the sources, the cutting edge fashion technique, where the genital organs are pierced and it looks very odd, and how far they can be useful is another of the issue, and this is one of the issues related to the medical practice now, and those who claim these practices in India as rare practices, they need to be aware of these kinds of practice. With this, let me conclude. सूत्रस्थाने कर्णव्यदबन्धविधि नाम षोडशोऽध्यायः. Summary: the ear piercing is a global practice, and abdominoplasty is one of the common reconstructive surgery. Classification and graded response to each described in Sushruta shows highly advanced concepts of the surgery. Global trends of body piercing is an area of concern to health practitioners. With this, we will conclude. If there are any questions, we will try to answer. There is one question. What would be the reason for doing karnavyadha first on dakshina? So there is, I don't know, I can't say. Maybe this is a general trend for any religious practices. For males, the right side is used, and for females, is the left, which is preferred. The exact reason behind this, we can't say. It's not only about karnavyadha. For all religious practices, this is a usual trend in our custom. The exact reasons, I don't know. Right? Okay. I think that's no other questions. So we'll conclude today. Fine.